Hi, my name is Jamie Prudencio, and today I'll be giving a presentation. Healthcare is defined as a maintenance system and improvement of physical and mental health through the provisions of medical services. This is which is defined by the Merriam-Webster Dictionary. Having access to healthcare should be universal and top tier due to the importance of each and every person's life. But sadly, that is not the case. According to the CDC, those who have frequently delayed or do not receive healthcare in general from the ages of 18 or 64, otherwise categorized as an adult group, is nearly 30%. Even worse, those who live in the lower socioeconomic communities in the United States face an epidemic where access is available, but the quality of care is not truly as what it could possibly be. According to Healthy People 2020, 3 things that affect the quality of care is the type of coverage, the timeliness, and the services that is provided. Coverage through healthcare systems can be negatively affecting the poor health status due to the lack of medical care, the late or lack of diagnosis, and there are more chances of premature mortality. Timeliness plays a huge role in what the system does and the way it does it. The way it quickly attends patients in their time of need and during their appointments. This may be conflicting because not all healthcare providers work in a timely manner. For instance, in my own experience, I've experienced being in the waiting room for over 2 hours after breaking my arm, in which I had to go to a different hospital in which they would assist me in a much faster and timely manner. Services also need to be improved because the quality of care is not always the best. The services from the doctors are not always in the best interest of the patient, but more so the doctor. In this way, doctors would be making more profit off the patients with diagnosis and different recommendations that are not necessarily important. Identifying and treating people with the symptoms and risk are important, but this may not always happen. Preventive services of clinics, emergency rooms, and hospitals sometimes show a lack of basic need. Decreasing life through the predisposed morbidities and the premature mortalities is always a huge risk factor in lower socioeconomic communities. Looking at this at a geographical standpoint, the socioeconomic status and race ethnicity play a big role in the opportunity to care. Those who identify as white are more likely to travel over 20 miles just to receive the care that anyone deserves. Those in higher density populations where hospitals tend to be overcrowded and usually can be far from these communities are less likely to travel 20 extra miles to receive care. The distance, the access, and the time it creates for the time you have to make in order to go to these places create a huge disadvantage for racial minorities. In this specific situation, one can hope to find a solution in which eliminating this geographical disparity and removing financial barriers can reduce the prevalence of this health disparity. It is really, really important to understand that one should be making clinics with better care and with the most appropriate equipment and physicians, but also understand the financial barriers that come with those who do not have the top-tier coverage. The greatest fire escape to this entire problem would be the possibility of creating a world in which considerations of each lower socioeconomic person is taken into consideration. This in order creates a very customizable care solution for these patients. It is something that may be greatly affected by the politics of the government and the healthcare system itself and the way it is set up, but it may be truly the best idea. Kangavi et al. State that the understanding of the various disparities that a person faces and creating the best solution to their physical and or mental health problem is important, but also understanding what is the most affordable and most logical and best working solution for them is the best. It is truly something that should be ultimately universal for everyone in this nation, and those with lower socioeconomic statuses are presented to a healthcare system for failure. So treating them at clinics that are under-equipped, and then given their care that is not the best fit for them, will set them to fail in this healthcare system. Allowing those to speak up and then unravel the complexity of those who are in need to get the quality of care they deserve is essentially the best solution.